Terribly disturbing news out of Los Angeles. Bronny James, the 18-year-old son of LeBron James, collapsed after suffering cardiac arrest during USC's practice.
I agree. Very, very disturbing what's been going on with young famous people lately. So let's see how Good Morning America decided to react to this disturbing news.
And now to the son of basketball superstar LeBron James, recovering this morning after suffering cardiac arrest during basketball practice.
Take note of the repeated concern about Bronny James's age being 18 years old. Pretty young.
Is just 18 years old.
This part was a truth.
And Bronny in stable condition this morning after collapsing during a workout here at USC's basketball facility earlier this week. Doctors say it was the quick-acting medical staff here at USC that very likely saved Bronny's life.
Now, this next part is also true, but now you can start to see sort of this trend of focusing a lot on the back end, what to do after someone already has cardiac arrest, what to do after somebody already has blood clots. Guessing it's because talking about prevention without talking about COVID is pretty dicey.
He was rushed to the hospital.
It truly, truly matters, especially in those first 30 seconds. CPR and calling 911, and if there's a defibrillator, getting the defibrillator out, and if it says shock, shock.
According to the American Heart Association, it performed immediately. CPR can double or even triple the chance of surviving cardiac arrest outside of a hospital.
But don't worry about avoiding catching COVID, because prevention, not important. You can learn CPR and everything will be okay.
Experts say although cardiac arrest is rare in young people, it can happen suddenly with little to no warning.
Rare. But are there other recent events that might call into question the rareness of this event? In the COVID era? I don't know.
Damar Hamlin, the Buffalo Bills safety who suffered cardiac arrest mid-game last year, sending Bronny his well wishes, tweeting prayers to Bronny and the James family as well. Here for you guys, just like you have been for me my entire process.
How interesting.
Well, a medical team that treated Bronny, all too familiar with what to do. They actually treated Bronny's Trojan teammate, Vince Uwachukwu, just last summer for cardiac arrest.
So rare enough for two students on the same team back to back to have this happen. Okay. All right. Okay.
Typically, if it's occurring in peak exercise, that is a very concerning feature for loss of consciousness.
All right, now keep in mind that he just said it's very concerning when it comes with exercise that we have these events and that they result in loss of consciousness. Very concerning exercise. Unfortunately, the concerning part of that clip was overshadowed by the emphasizing first of this can happen to athletes, as if it's normal. So normal first, concerning second. This clip came before the previous. Let's watch.
This unfortunately can happen. It can happen in high school athletes. It can actually happen even way before that.
So don't worry, y'all. It's rare, but also note, it can happen. Rare, but totally normal.
Dr. Sutton, how often do you see an 18-year-old like Bronny with cardiac arrest?
Well, Robin, it's relatively rare. The statistics state that this only happens in 1 in every 50,000 to 100,000 cases.
Rare.
But we do see this in athletes because, as you know, being an athlete, you're pushing yourself to the physiologic limit.
True. But by medicine standards, these are also the same people who are so much healthier than everybody else that they're the best equipped to push themselves to that limit. So it seems that we want to have it all, huh?
There are some that may have underlying heart conditions that they may not be aware of.
But definitely not heart conditions related to COVID. And the lack of awareness, definitely not, because we have failed to stress this to people as a thing that exists, that is a problem. Q, we tried. We did everything that we can. Being a doctor, so tough. So much tougher than being a patient. I know that like dying and stuff really, really could suck for you, but have you ever considered that, having the stress of saving you also really sucks for us?
Shock. And the entire goal of this is to get that heart rhythm back. And when that does come back, if and when it does, we do our utmost best to stabilize and support that patient in any way that they need while working up exactly what was the cause of their cardiac arrest and then getting them to the ICU.
So my question is, do you ever consider COVID as a cause? Spoiler alert, it's never COVID. See Tori Kelly.
Overnight, ABC News confirming Grammy-winning singer Tori Kelly rushed to the hospital after collapsing while out with friends.
Pretty concerning.
Friends of the Nobody Loves singer telling TMZ she passed out at dinner after her heart began beating rapidly, saying Kelly was out for a while. Sources close to the singer say she was carried to a friend's car and rushed to Cedars-Sinai Hospital, where doctors reportedly found multiple blood clots near her vital organs.
It honestly is so amazing to me that we are so concerned about these things and so insistent on just ignoring COVID.
Sources say she's in and out of consciousness as doctors work to determine if her heart is in danger this morning.
I mean, I'm not that kind of doctor, so I don't know about the heart specifically, but I can say that, yeah, something is in danger here. Come on, y'all. Now, Tori is slightly older than Bronny at, 30 years old, but notice, still shockingly young.
Joining us now is ABC News Chief Medical Correspondent Dr. Jennifer Ashton with more. Good morning to you, Dr. Jen. So how common is it to hear about blood clots in a young person?
We're seeing it absolutely can happen in young people. It's responsible for 60 to 100,000 deaths in this country every year.
60 to 100,000 deaths per year. Would anybody like to guess the population of the United States? But if we present a really big number, people will not question.
All right, so what should we look for? What are the symptoms?
Well, listen, I think that the most important thing for people to understand is that, yes, it can happen to young people, particularly women on birth control, hormones, after surgery, if they sit at a desk job, prolonged travel, or immobilization.
But obviously not COVID. But hey, we all got to cope, and it is a really shitty reality.
This is personal for me. My daughter had one 2 years ago.
My brother as well.
Yeah.
It's so scary. Yeah. Tori Kelly, only 30 years old.
Right. So awareness is
I was just going to say, really important. We're talking about it.
So be aware, y'all. Clots, cardiac arrest, they could happen to anyone at any time. We need to raise awareness, but not awareness about COVID, because obviously COVID could not be a factor in any of these things. Stop reporting like this. Y'all know that's not the truth, and it's getting ridiculous. And I understand that we all need to cope, but your job is to inform the public. Your discomfort does not excuse you misinforming or failing to inform the public. Let's not.